I'm Dr. Mandy Wyant with Family Chiropractic and Wellness. I wanted to take a moment to tell you a little bit about common conditions we see in the low back and hips and how that can correlate to x-ray findings. So here we have a model of the low back, pelvis, sacrum, and the hips as they come in. From this view, we're looking at yourself here back to front. We should see on an x-ray that everything is straight up and down at the spine. It should be level across the pelvis and hips, which that to you would be your waist area, and then level across the hips, actually the legs as they come into that pelvis. So what I'm looking for usually from a straight on view is is there curvature, how does the alignment look, but also how healthy are the joints. You can grade arthritis in the hips from this view. Also in these joints here, your SI joints is what those are called. And then a side view that we usually take to go hand in hand with that really shows you how healthy the lower back is, the lumbar spine. So you can tell from a side view if there is degenerative arthritis or osteoarthritis, they're the same thing, in the lumbar spine. And you can tell that because on an x-ray you usually see some loss of joint space. So that tells you that that disc is degenerative, you're starting to get some wear and tear of that joint, and that can correlate with symptoms. So that we like to usually see the grade of arthritis because that also helps me give patients a better idea of long-term what to expect as far as progress goes. But I want to talk about for the hips a little bit. You do not see bursitis, tendonitis, those types of conditions on x-ray, but we can almost always tell that pretty easily based upon a history with the patient or based upon a hands-on exam. But what I do commonly see is changes in the joint health of the hips. So we can see arthritis, but usually it's one hip is affected and not both hips. Because people always tell me, I'm just getting old. Arthritis is a normal part of getting older. And it is to some degree, but for most people, we see the right hip has moderate arthritis and the left hip looks really good. The right hip's not any older than the left hip is, so that really tells you that mechanics play a big role in wear and tear, in osteoarthritis over the years. And that's really where chiropractic can help, is you can really slow down the progression of arthritis in that area by working on what might be happening around it, the muscle tension, the motion through that pelvis and low back, and help get some of that day-to-day strain onto that left side so that it's a little more balanced. Just like with your car tires, if they were never balanced or rotated, you would start to see one really showing signs of wear. Same thing in the low back. It's usually one level we see arthritis at, not all of them. And that's really where you get your car tires aligned and rotated because it spreads the force out more evenly. And that's what chiropractic can do. We can go over what we can do to work on that, and then also some things you can do to work on that, to slow down that progression from happening so that you can stay healthy and active as you get older too, and it's not just arthritis that's causing the pain. So if you have any conditions or at least want to sit down and get this area checked out, I would be happy to help.